Are you a high school baseball pitcher that's been dealing with pain on the front of your shoulder for the last couple outings, and it's just gotten to the point where you can't even play catch, let alone pitch anymore? I'm going to go over today one of the more common types of shoulder pain that I see in pitchers in our practice and how we go about identifying it versus compared to other injuries. So how do I know this? My name is Dr. Jeff Lewis. I'm the owner and physical therapist of Lewis Physical Therapy and Sports Rehab in Point Pleasant, New Jersey, where I've helped countless baseball players get back to throwing pain-free, get stronger, and throw harder after an injury. Shoulder pain sucks, especially if you're a pitcher and it gets to the point where you just can't deal with it anymore and it's causing you to sit out and shut down from not only pitching but throwing. One of the more common cases of shoulder pain that I see, and this is across the spectrum, whether it's a pitcher as young as 14, 15 years old or a veteran big leaguer, is pain on the front of the shoulder with pitching. Shoulder pain can be complex. There are a lot of structures in the shoulder that guys can get hurt as a pitcher. Bicep tendon, labrum, rotator cuff issues, impingement, bursitis. There's a ton that can go into. For the purpose of today's video, I'm going to talk to you today about biceps tendinopathy issues in pitchers specifically. So your bicep tendon. So your bicep, we'll start with the big muscle in the front of your arm here, the bicep that we all like to train and whatnot. That bicep runs up to the front of the shoulder. So if you look at this diagram here, so you can see this blue sheath here. So that is that long head of the bicep tendon that's coming up the front of the shoulder and almost to the top like that. So that bicep tendon runs right along the front of the shoulder there, and it attaches to your labrum. So it's a hugely important structure that we want to be mindful of in a pitcher that's having any type of pain in the front of your shoulder. That bicep tendon, more often than not, is the pain generator in a lot of cases. Now, I'll say this. I've seen very isolated bicep tendon issues where there's really no labrum or potential labrum involvement, but I've also seen cases where there's very likely a labrum tear and the bicep tendon is what's flared up. And depending on who you ask, some people will tell you the labrum is the pain generator more often than not. I've come to find out that it's the bicep tendon that is the pain generator in a lot of these cases more than anything. So when we're pitching, we need to get into maximum external rotation, into layback like that. So every time that we get into layback, that bicep tendon, it almost gets, if you just pretend like my shoulder here is going up and rotating back like this, that bicep tendon essentially just gets twisted and a ton of tension is put on it as it's going into external rotation like that. Now, that tension creates what we call the peel back mechanism, where it literally pulls the labrum away from, and again, the labrum, so your shoulder is a ball and socket, the labrum sits in between that ball and socket groove to help improve stability. When you're going to maximum external rotation and layback, that bicep tendon literally peels the labrum off of the glenoid, which is the bone that it attaches to help it create more mobility more than anything. The other side of the bicep tendon where it's commonly affected in throwing is really at release and follow through. So when you're from here coming through, at this part coming through, you're getting a lot of eccentric stress on that bicep because your arm is literally getting pulled out. So the bicep tendon is trying to control that eccentrically with with your rotator cuff as well. But in general, here are some of the things that I like to listen to and look for that might tell me, okay, this is probably a little bit more towards the bicep tendon versus anything else. First off, more often than not, their pain is on the front of the shoulder. And I'll confirm that from a palpation standpoint. I will get on that bicep tendon and I will almost kind of flip back and forth over it. And I'll do this on both sides of the shoulder. And in guys that have a very flared up bicep tendon, the minute you flip over it, they're going to be like, yep, that is it. And I'll ask them, hey, is this where you feel pain when you're throwing? And they're like, yes, that is exactly it right there. One thing we want to be mindful of in our younger throwers, guys that are less than 16, when those growth plates are still open, if they're starting to get some pain that's not necessarily on the bicep tendon, it's a little more on the front and side of the shoulder, we can't necessarily rule out little league shoulder at that growth plate. And at that point, it might be more a matter of, hey, probably worth going to get an x-ray to make sure that growth plate is in a good spot. If it is little league shoulder, that's a very extensive time of being shut down from throwing. But that is bicep tendon-wise. That's very commonly that pain location. You'll be able to, if it's that, you'll be able to tell with good palpation skills when you're right on and that's the painful structure there, okay? Next, we go into range of motion. So overhead flexion, internal rotation, abduction out to the side as well. It could be painful with one of those. It could be painful with a lot of them. I've seen it in both ways. One thing that I will do to confirm whether, hey, is this really the bicep tendon that is being irritated more than anything, is I will give a little bit of help at the shoulder blade. So if a guy goes and moves their arm up overhead and they get to the top, like, hey, it just feels like it's pinching right on the front there, almost like right on that bicep tendon, I will essentially move their shoulder blade for them into upward rotation and a little bit of some posterior tilt. In a lot of cases where this bicep tendon is getting that, quote unquote, impingement or some type of tendinopathy there, you moving their shoulder blade is going to help, is probably going to clear that space up. So if you move their shoulder blade and they're like, yep, I don't feel any pain anymore, when you do that work for them, it's a good indicator to you that, hey, this is probably something that needs to be focused on with a lot of scapular stability and strength. And that could be for any of these range of motion tests there. Then we'll certainly look into strength. One thing that I find is that with bicep tendon issues, I've seen it both where guys can be weak with external rotation with bicep tendon pain, but they can also be okay strength-wise but still have bicep tendon pain. In these cases, I'll again cue someone to keep their shoulder blade engaged and then push out, and in a lot of cases that helps get rid of their pain more than anything with that. All right, so that's from a bicep tendon pain, what we really look at from there. It's different where if you have pain on the side of the shoulder or the back of the shoulder, you're not going to have, that's not going to be bicep tendon pain. At that point, we're looking at maybe more some rotator cuff, maybe some posterior labrum issues as well. But bicep tendon pain is going to be very much isolated on the front here. From a management standpoint, a lot of it is thoracic spine mobility. We're going to take a look at lower body stuff as well to make sure that there's no, especially for a pitcher with how dominant lower body movement that is, make sure there's nothing playing into a role there. It's going to probably be a lot of scapular stability and strength. We're definitely going to get some rotator cuff strength in there as well because that's definitely not going to hurt to do. We probably will look at throwing mechanics a little bit. If we have a guy that is what we call hyperabductor, where their arm gets very behind essentially their body as they're getting into their throwing motion, that is naturally going to put a lot of stress on the front of that shoulder, or if their arm is up like this in that inverted W position. So that's how throwing mechanics will play a little bit of a role into that. Generally, I would say, so in a younger guy, like 14, 15 years old, we're probably going to be more conservative. Take up to 3 to 4 weeks off of throwing. Really just take the time to get these issues under control instead of them getting longer in their career trying to prolong it. In an older guy or in a guy where it's, hey, this is like crunch time of the year, they've either a lot of showcases coming up, it's playoffs time, like really very time sensitive manners. There's a lot of times that we'll have the discussion of, hey, listen, we can possibly get through this depending on the severity that we find with the exam. It's going to be a lot of work on them in the front part, and it might not feel 100% every throw they go and make, but we just constantly are reevaluating and seeing, hey, like if we're going to work through this, keep playing while we're working on some of these issues, it might take a little longer because throwing is what's going to aggravate it more often than not. So that's the process of how we go about identifying bicep tendon pain issues in baseball players, especially pitchers, compared to other issues in the shoulder like labrum, impingement, bursitis, rotator cuff issues. Bicep tendon pain is probably one of the most common things that I see in pitchers, but especially in younger pitchers as well. But again, it can affect any pitcher of any age and any profession. So if you've been dealing with pain on the front of your shoulder, whether it's with pitching, thrown off the mound, or even just light catch play out to the point where you can't even play catch out to 45, 60 feet without pain there, go ahead and leave below any questions that you have specific to your shoulder pain. Or if you want more individualized, personalized help to help get you back to throwing pain-free, go ahead and text that number below and we'll get back to you.